Hi, this is Dr. Derek, and today I'd like to talk with you about the importance of cranial alignment. Now, for some reason in my office today, I saw a lot of patients that had problems and symptoms, and it was actually coming from cranial misalignments that was putting pressure on the brain and causing a symptom someplace. And when this happens, it is an unrelenting symptom that is almost impossible to get rid of until you work the cranium. So, and the cranial bones are held together by sutures, and they're actually movable. A lot of people don't know this, but these bones actually expand and contract. And when you have a misalignment, say you have a fall, you have a blow to the head, you have something, that type of trauma that occurs to the head, these bones will misalign and wreak havoc on people's health. And so what we do at our office here is we have a method using the Taylor method to discover which cranial bones are misaligned that are causing a symptom. Let me show you this poster over here. So when these bones are misaligned, it'll actually put pressure on the brain. And when pressure is on the brain, it will cause dysfunction below the brain. And so it can cause neck pain, it can cause even back pain. I had a patient today that she had back pain. We cleared a cranial misalignment here. It fixed her back pain. I had a patient today that had bloating, and we did a cranial treatment, and it helped her bloating. We had somebody recently had neck pain, and it helps with neck pain. I just had a person yesterday that came in, and she had taken a fall 2 years ago, and since then she's had seizures, she's had migraines, and in fact, when she looked at this set of vitamin supplements, she had a sense of anxiety or dizziness, or just felt really weird. And after we cleared the cranial misalignments, that was gone. And so, I just called her, got off the phone, she feels a whole lot better. So what do you do when you have a cranial misalignment? The treatment is very gentle, and it feels very good. So we find out where these misalignments are, and we gently put it back into place. And recently we added to our office some new energy wave therapy, and we use this now for the cranial misalignments, which gets even greater results. And so I just want to inform you that if you do have a symptom that you've not been able to get rid of it, it may be due to cranial misalignment. So I'm trying to think, what can you do at home if you have a cranial misalignment? Well, there's not much you can do. You have to go see a cranial specialist or your doctor that has had special training to work with the cranium. But what you can do, if I want to give you something, you can, if you want to, here's the tennis ball again. You could get the tennis ball and work on these muscles here in the suboccipitals. And so you're lying on the floor, and it's just digging into the back over and through here. This always feels good no matter what. You have a bunch of muscles here in the back that attach to the skull called the suboccipitals, and these will get tight, and that'll pull actually on the bones and create headaches and issues for people. So just by doing a tennis ball roll here, that's a beneficial thing to do, and it just feels really good. And so I hope this has been helpful and educational for you, and this is Dr. Taylor signing off.
Hi, I'm Linda, and I've been seeing Dr. Taylor for about 2.5, 3 years, and he's helped me a lot with the adjustments and different treatments that they have to offer here. Recently today I came in because of stiff neck and stiff back and problem with my legs, and after my treatment he did a cranial adjustment, and my back isn't stiff anymore, my neck isn't painful anymore, and so I recommend that very much. Thank you, Dr. Taylor.